Hi, everybody. Immensely honored to be here together with my colleagues at our podcast about the future and how the future is going to look like in 2050 and beyond. And before we represent our very honored guest, I would like to ask my colleagues to represent themselves with 1, 2 sentences. So let's start with Dr. Varghese, please.
Hello, good morning from India. My name is Sangeet Varghese, and I am the president of the International Foundation for Sustainability, Peace and Development, which is based out of Eastern Europe and which happens to be one of the largest in the Black Sea, Caspian Sea region, ushering in peace, development, and sustainability. In addition to that, I am also a young global leader of the World Economic Forum and I consult for nations as well as international institutions. Welcome to the show, Your Honor, and I'm glad to be here. Thank you.
Tamash?
Thank you, Karen. And yeah, good morning, Your Excellency. It's really a pleasure to be here. And thanks for Karen for organizing this. I'm right now in Manila, in Philippines. I'm one of the directors of the WHO Regional Office for the Western Pacific region, which comprises 1.9 billion people and 38 countries here. Uh, and I'm also a young global leader as Sangeet, and we wrote a book together on the future of future intelligence. And I have been working on future intelligent leadership over the past years during my research, PhD research, and other researches. So happy to be here. Thank you for accepting our invitation.
Thank you very much. For me, it is much easier. You know, in the first place, I see myself as mama. So I'm a mother. I am full heart doctor. I am passionate, very passionate scientist. And I'm visionary futurist dedicated to shaping a better, brighter, and healthier future for the generations to come. And I'm very sure that today's discussion will very much tend us into that direction because we are very honored, all of three of us are very honored to have the esteemed guest, His Excellency Dr. Bandar AlKnawy, who is the Chief Executive Officer of Health Affairs at Ministry of National Guard and also President of King Saudi bin Abdulaziz University of Health Sciences in Saudi Arabia. Thank you very much for accepting our invitation and welcome to our podcast.
Thank you very much, Karina and colleagues. Consider myself, as Karina said, a physician who is leading healthcare for the last many years uh, with many institutions and have a good ecosystem of health sciences university and as well research centers in the country and been running health institutions for many years and has seen a great improvement and development over many years. So we'll be happy to share with you this morning some of our thoughts and as well engage into a very futuristic discussion.
So let's start our interview. Just for the viewers and listeners, for us, we are all in different parts of the globe. So I just said good evening because it's very late evening at my side, and Tamash said good morning, and it is afternoon at our other two partners. So it's symbolizing already the global future. what we are doing right now. So we're gonna try all of three, ask questions that we care about, and see how our guest sees the future of the globe. Tamash?
Yes, thank you very, very much again for accepting to talk to us today. And you mentioned that you have been thinking and working a lot on in healthcare and the future of healthcare. Would like to, maybe as a way of introduction, to know what was your perspective for the next 50 and next 100 years. How do you how do you see the envision the future of the world in the areas, in the sectors where you are working, and what would be the most bold differences compared to today? Over to you, sir.
Great, thank you, Damash, for the question. I think all of us see the development and the future of healthcare uh, as something that all of us would need. And of course, if you look at healthcare, it is something that has been a very, very important issue for every one of us in the system. And healthcare is quite valuable. I always would like to feel healthcare is an organization of people, because when you see healthcare has, as a system, has almost three elements. We have patients, we have families of patients, and third one is the workforce, who are as well humans. So all of us are really working together. And what is really new and futuristic about healthcare is how the new digitalization of healthcare would really change the future of how do we deliver healthcare and how we can ensure that healthcare is done at the best and as well done all of this. Healthcare management is quite complex. Let's put it this way, because it involves humans quite significantly, where patients have diseases, have illnesses, and of course, workforce trying to help patients and make sure that the way it is going to be done. I think there are a few things which can deal with illnesses, and as well, let's deal with healthcare as not illness take carers, but more of trying to prevent illnesses and make sure that we really develop healthcare. So we always look at how do we engage into the best way to deliver healthcare at these days. Many development has been done recently on how healthcare is being taken care of. I'm a very strong advocate of technology in healthcare, and it should really shape the future of the way that we see patients, the way we deliver medications, the way we take care of patients at home, and many of these issues. And truly, I'm quite advocate of open human intelligence. There are recently the open AI, and many people are working very hard on how to do this. So I'd like to call it open HI, and taking it on that kind of concept of ensuring that we really see this. We see the digitalization of healthcare, or technology in healthcare in general, as going to be the sea of change, where we can look at not only making sure that we have digital health, but as well artificial intelligence and digital health. Of course, the rest of all of this required. During the Saudi Arabia presidency, G20 presidency, in 2020, during the height of the COVID pandemic, and of course, that presidency, summit was held virtually, so it was able to hold all G20 global leaders through virtual platforms. I had the privilege of being asked to organize a digital health conference or a summit. And let me tell you, it was probably the largest virtually attended conference, that we had more than 100,000 attendees from all over the world describing how digital health would really help to move this quite forward. And during that meeting, actually, we had a discussion from all over the globe. You know, we had people who are attending from over the speakers, and it was over 3 days. And I wrote a paper in Lancet, you know, describing as a commentary what really has happened through that time. So digital and digital health is really going to really improve significantly not only the delivery of care, but as well the change of the way we deliver healthcare, i.e. diagnostics. And this is really going to be, confidence going to be completely switched off. We have so many big machines like MRIs and CT scans, big gadgets to deal with patients, operating rooms. These things are going to just gradually improve forward and forward. Not only that, I think drug deliveries, how medications, you know, we think of, it's going to be different in the future. Targeting diseases through some artificial intelligences. For example, chemotherapies. Is it going to be the same chemotherapy that people are using for cancer? I.e., you know, when we give chemotherapy, they go to the blood and they go everywhere and they get side effects and complications. Are we going to get a targeted approach to nanotechnology, nano AI, all of these medicines that are being delivered to treat illnesses in a different way? So these are very critical, and these are the things which are going to be hopefully a game-changing approach towards that. So we look forward always to see how can we be more of an advocate through this. And I'm sure human knowledge would definitely improve this. That's why I was kind of looking at OpenAI, OpenHI, and try to make sure that we would not have in healthcare a closed system, the same as an OpenAI. So we want to have more of an open platform to deal with patients. And of course, I think in this day and age of borderless data flow, we need to make sure that the data flow for patients and taking care of them when they travel, when they go anywhere else, and with movement of people are being taken care of. However, we need to have a balance between innovation and regulations, because we want to make sure that best practices are being delivered. We have to make sure that data integrity are being taken care of from that aspect. So clearly, I think the way we look at it is to make sure that we engage into this. We make sure that as well healthcare leadership in the future going to be more embracing technology and making sure that they start working and developing the required workforce. Without this, without people embracing technology as from the grassroots of the healthcare workforce, it's going to take longer time to make sure that we move to the next level of the future. For example, in our Health Sciences University recently in January, we have organized what we call the Health Hackathon, which we have done for the last 3 years. We have 12,000 students attending this, and it basically talks about how we shape the future of these health sciences students into looking at technology, robotics, AI, ensuring that we look at different ways of modalities of handling issues related to healthcare and healthcare management. We were privileged actually to receive almost 1,100 projects, and through different committees we were able to shortlist them to 122, and at the end 6 has you know, won the awards for this. But I think these are the different things that we need to continue to develop to make sure that they're not only trying to give them knowledge and skills, but as well look at the health sciences curricula, you know, the way we teach medicine, the way we teach, you know, pharmacy, the way we teach, you know, public health and the rest of health educations. These are very essential, and I think future leaders of academicians and healthcare providers or professionals should continue to improve them, should continue to make sure that we are trying to advocate this into the way to go. So this needs to look at it as more of a comprehensive solution rather than, you know, just looking at how do we tackle these things and maybe pick and choose from different whatever available technology platforms, but as well develop a huge movement from the education, management, and of course, you know, pharmaceuticals and industrial healthcare that we always, you know, depend on to provide the best for our patients. Maybe I'll stop here.
Thank you very much. Thank you very much. In fact, I found it very insightful. There are multiple domains which you actually delved into. The first one, of course, being the digital technology part of it. And I was especially enamored by the particular word which you used, open HI. So when we are talking about technology on one sphere, whether it is robotics, whether it is AI, whether it is open HI, which you are talking about, and then the other sphere which you spoke about, which was again very interesting and insightful for me, was about the G20 presidency and how you combine the G20 presidency along with the digital part of it. Which actually brings me to the next question, which is about, from a G20 perspective, there is a developed world, there is a developing world, and the social needs of both these ends of the spectrum are very different, and the technology part of it. So my question is that when you look forward 20, 30 years ahead to 2050, how do you imagine the healthcare provision metamorphosizing, changing in order to meet the needs of this developing world, the developed world, and the change the social needs? And of course, like you rightly said, enabled by technology. How is technology going to enable this change in the healthcare provision? Thank you.
Thank you, Dr. Farghese. Sure, I think since we have had this meeting almost 4 years ago now, we've been really working with WHO to continue to develop how can we skill and upskill professionals in healthcare digitally, globally. Making sure that underdeveloped digital healthcare systems that are trying to meet the need of the future. And I think without this strong foundational infrastructures that as well can be able to deal with patients, deal with healthcare, deal with the way that we approach patients in healthcare, we are not going to be able to, as I said, to create a very clear and as well swift way of improving healthcare. And not, I think we're trying to really focus on healthcare from a public health perspective, trying to learn from the pandemic approaches or what happened in the pandemic. If you look at the public health specifically, public health, it is somehow disjoint between health institutions which are delivering the high-end healthcare, and frontline people who are at the different areas of villages and small communities, and trying to ensure that we really connect public health, and becomes not peripheral, but however in the center of healthcare. And from there, I think what has been recently being discussed is healthy aging. How do we look at this? And there are a lot of work, by the way, a lot of work, huge amount of work on discussing healthy aging. And this is again a future domain that is going to be taking a lot of activities, trying to create through public health, through different ways of handling healthcare in general, and to healthy aging. And as you know, there are, with the advancement of healthcare, there are, the health spans are really, or the age span is increasing. But how do you make sure that it is healthy rather than, just, expanding the age or improving the age of people, but not making it quite healthy. So this is again a lot of work is being done, and I'm pleased that as well our system is taking care of this as well through the scientists, through as well making sure that we contribute to healthy aging. So going back to your question, I think how do we make sure that digital approach to healthcare is being globally advanced is needs a significant amount of work. I know the people at the WHO are doing a huge amount of work to ensure that we improve connectivity, and we improve the way we reach out to people through improving their healthcare. I think we need to look at the future. Are we going to, for example, the surgical approach to surgeries? Is it going to be done by robotics? Are they going to be able to do this remotely as well? Because this will help to currently robotic surgery or minimal invasive surgery, as people would like to call it, or is being improved, but maybe in the future it could be done differently, because that will reduce complications, side effects, the speed of recovery, so many things. And precision as well is very important, not only in surgery but as well precision medicine, and many people are talking about this. The genetic modeling of diseases. I think now we look at genetic diseases, but in the future maybe you're looking at the most common diseases like diabetes, hypertension, which cause a lot of complications and healthcare expenditures to deal with these non-communicable diseases or chronic diseases. So looking at precision medicines, I think, is going to be future things. And we need to look at how do we engage in making sure that healthcare providers who are really taking care of patients on a daily basis really engage with pharmaceuticals, with diagnostics, with healthcare industry, to make sure that as well this movement move forward. And we see as well many of people have recently seen a study looking at how health sciences students are really looking at digital technology in general. Quite a large part of them, actually, some of them actually move from being able to be a physician to become a healthcare technology advocates or healthcare technology future leaders.
This sounds really very futuristic and very interesting. And being honest, I am myself, and we all actually for healthier future, for the unhealthiness. And on your own idea as a healthcare manager and very successful healthcare manager, what diseases in 2050 and 2100 will be the obstacles to unhealthiness on planet Earth. To be just healthy on planet Earth and have no diseases, a pan-healthiness status. This is the dream, no? To be just healthy.
Well, I think if we look at now what is happening in the genetic modeling of genetic disease, which are usually very difficult. These are inherited diseases. These are, can cause problems and can cause issues. For example, the most recent, for example, is blood diseases. Inherited blood diseases. Now you can actually cure patients by giving them a gene therapy that as well will try to completely switch the red blood cells to a normal blood cells, and that's really a major modulation. This is really complete switch. Nobody thinks of it. This is now the new layer, and we are going to see more and more the new layer after stem cell transplants, CAR T cell transplants, and all of this. Now we're looking at targeting the gene itself, and it used to be, for example, in genetic diseases, is try to prevent genetic disease through genetic testings, or during pregnancy or pre-pregnancy, plannings. But now, if there is, a genetic illness has occurred in a child, as well as that, we can completely modulate and move forward with that. So that's, I think you can see it as a very important. I think you asked which disease will be the most difficult, and I think looking at things related to brain, I think is going to be, or muscles. These are going to be the next futures of trying to handle this, because now the approach to neuroscience is completely different. Brain management. We see Alzheimer's disease, for example, now is being handled in a different way. New medications and things like this. I think it's ultimately trying to create medications with no side effects. And that's where, genetic modeling, that you give medication once and not necessarily having it regularly for all life, is again, that's the future. For example, we look at managing diabetes or hypertension, these are the most common illnesses globally, is by taking medications on a daily basis. Are we going to see the future, inshallah, soon, that you will not require to be taking this? And we're seeing this now. Cholesterol management is not as usual, is given once a day or twice a day medication. Now it's given every 6 months, every 3 months, an injection. So that's, again, we'll look at this. So maybe we see quite a great enhancement and improvement on the way we deliver medication. So again, there are lots of studies on how to deal with hypertension, which is, again, complication of hypertension, stroke, renal failures, heart attacks, all of these, major health illnesses. Hopefully that we see something that can switch off, these kind of blood vessels that will cause, high blood pressure into a different way. So manipulation of diseases through technology and through different things, I think will handle this. So it's probably difficult to answer which disease, because we see quite an array of significant improvement, and as well depth in research. Well, infection, it looks like as well is going to be, if I want to label which one will be difficult, I think it's infection, because these are emerging infections. Some of them, they're not even known. And, viruses, change and models, and the virulence of viruses are going to be different. In the past, used to be more bacterial, parasitic infections. Now we see more and more different viruses being discovered and as well, causing this. So these are the ones which gonna be, we have to have high alert and sensors to look for them, because I think we can not forget that the pandemic has caused a global shutdown just from one virus infections, and the spread of virus infections are quite different than many other diseases. So trying to predict, I think, is very, very essential. Very essential. That's why I think the focus on public health and digital public health, that will improve the health security of the future.
Thank you for that answer. And you referred to the pandemic, which is something very recent, and it, as you said, it impacted the world. And I work with the WHO. We still have difficulties in getting the pandemic treaty signed. It's not that simple, despite this common experience. But in the future, given that all the health systems will become more interrelated, we hope at least, how do you see, which approaches would you imagine in the future could be more successful in addressing emerging pandemics or other types of diseases of a global range, infection, cancer also. But let's keep to the pandemics, which is a recent example, and definitely we know from our prediction anticipation models that there will be other pandemics coming for sure. So how do you see us being better prepared in the future?
I think connectivity, without being interconnected, in this age of, now we are quite interconnected here through this digital platform. I think we need to make sure that as well the flow of, as I said, trying to develop a borderless data flow is very important, very important. And making sure that, and this has been a lot of debates, if that talk about health passports and things like this, and studies addressing this, is trying to regulate this and making sure that we have the best practices through that. And without open borders for health, the same as we have the Ventec now. The Ventec is you can go anywhere in the world and you can use your credit card, you can use whatever way you can, cash machines and things like this. It's so advanced, and I think health is more valuable than money, I think, because it is without health you cannot do anything. So I still go back to see that digital public health, digital epidemiology is very important, very important. If we can develop this, if we can enhance this aggressively, this is the way to go, and it needs a tremendous amount of effort and as well effort, enthusiasm, and as well acceptance from healthcare practitioners and healthcare leaders to make sure that this is the way to go.
I'm actually enjoying this conversation, especially the points which you're making about the interconnectedness of the world, the digital driven part of the world, part of it. Which actually brings me to the next question, and especially since I am from the developing part of the world, where the most important issues which are in our mind at this point of time is the equality as well as the equity concerning the developing world. So my question is that in this, the digitally driven world which you are talking about, the interconnected world which you are talking about, how do we ensure equitable access across the world? Thank you.
This is quite difficult, but however, trying to get everyone to deal this with equity we look at equity in workforce. If we do not start there, by making sure that a lot of people, for example, in healthcare workforce have a lot of equity and equality in there, of opportunities, making sure that they have the equal right and access to skills and competencies and ensuring this, I think then you can have not only digital interconnectiveness, but as well workforce interconnectiveness. This will ensure to widespread throughout the world, and I'm really pleased to see that there is a lot of work is being done to ensure that this is being driven, and you can see huge amount of articles and publication on a daily basis on trying to ensure there are no disparities, or at least try to work with these disparities globally and within communities as well, within regional communities. We will not do it. Still, as I said, open HI. Okay, it's very important because that's we cannot work with a closed system. Okay, and let's learn from ChatGPT and all of kind of things and how we can ensure to advance this concept. And I am pleased to discuss this kind of particular things today with you as a global futuristic leaders, and as well trying to develop future leaders as well, is to look at how can we be an advocate of this kind of doing things without equal access to knowledge, science, and as well trying to ensure that as well the distribution of healthcare industry is being taken care of, we will have problems. You see that during the pandemic there were just simple issues of logistics, how it made a huge impact on people. People did not have masks, did not have simple things, sometimes. Oxygen, supplies of these issues are going to be important for developing equity of the future.
Thank you very much. It's very insightful. Um, we have spoken today from the precision medicine, from gene editing, from personalized medicine, to the just oxygen providers and the masks, from the whole palette of the technologies. And the question is, from your perspective, what will be in about 100 years from now the most important future health technologies that will keep us healthy? And what we should do today to reach that healthy future in 100 years?
Well, I think prediction. Predictive healthcare is again a big domain. How do we predict, cell changes, in the body? We know that, for example, how we, through prediction, is maybe you can divide it into prevention, so you can not have an advanced disease, but as well try to predict illnesses through different technologies. So this is again a big issues that as well we look forward to see that there is a lot of work on this. Predicting illnesses is very important. Same as people try to predict, stock markets and things like this, and although not totally effective or not totally accurate, but I think prediction of illnesses is going to be a job that everyone should look at. Same as prediction of infections, not trying to stop the spread, but predict that it's going to happen. Again, that's one of maybe Damesh, question. How do you do this through WHO, developing these global agencies, global supranational agencies to help this? Look at this. So prediction is, I think, is essential.
Indeed, and you mentioned global agencies, so that's where I come back in. Uh, we are all living in a very rapidly changing future. The technology is accelerating the way we live, the way we work. Yeah. How do you think the future, the modern healthcare specialists can accommodate such a transition, such a quick transition, and embrace new technology, artificial intelligence, machine learning, in maintaining a patient-centered focus and protect patients from biases and risks that we usually try as healthcare professionals. And specifically, maybe you could tell us how you see that from Saudi Arabia perspective and the region in which you work, because the region changing so quickly in a rapidly changing world. So it's very interesting, I think, the lessons that your region can provide to the rest of the world.
Um, Changing, modernizing health education is very important. And without modernizing health education and ensuring that this modernization health education is being, through equity and equalities, is being as well throughout the world. I think we have, health, education that's been for many years, and we see a lot of changes. For example, in our healthcare system or our healthcare education, we work on web-based curriculum and making sure that students, learn from problems rather than learn from didactic sessions, and trying to make sure that these students are trying to receive the best. So again, trying to create an overhaul of health education is, I think, is mandatory now, not in few years' time. And we're working very hard in this in health education, and trying to make sure that, as we see from these different platforms of health education, not only delivering health knowledge, but the future of health knowledge.
Fantastic. Thank you very much. I'm finding it extremely insightful. And as we are almost nearing the closure of this particular exciteful and interesting podcast, from your perspective, I would like to know, rather, I would like you to look farther away into the future, using your experience, and tell us, what would the doctors of, say, 2050 or 2100, what would they be able to do at that particular point of time, 30 years from now, 80 years from now, what we are not able to do today? Thank you.
Again, trying to keep people healthy is very important. And looking at this, maybe patients will take care of themselves, take care of their own health in the future, that they will be able to, for example, maybe we will not have a typical hospitals, clinics, and whatever, but as well trying to look at this. We look at the future of healthy aging without illnesses, and having to self-take prescriptions is something maybe of the future. that you don't have to really go through the different way of healthcare things and hospitals and clinics and things like this. So I think these are going to be challenging, but as well preparing healthcare systems to do so is very important. So without the advancement of health industry and the future of health industry and ensuring that we develop a new platforms for health technology, engaging health technology aggressively, and taking care of that will be the way to go in the future.
Thank you very much. And we have the very last question for today's podcast, which is provide us with 1, 2 sentences of advice about future, advice about how to prepare for better future from looking from now.
Prevention and prediction. I think these are two different domains, but they're very much interlinked and intertwined, of illnesses, prevention and prediction of health care illnesses, I think, or diseases is going to be the whole work of health communities and healthcare professionals, healthcare industries, and healthcare managers. And the future of this is going to be depending on preparing the best skilled and as well futuristic workforce, which we need to work on them. And I think I'm re-emphasizing developing the future workforce is going to be one of these issues that can change the future for better and make sure that we live in healthy communities and healthy people of the future.
Thank you very much for answering our questions. It was incredibly insightful and it was very, very much really futuristic. And thank you very much, Dr. Landesh. Thank you very much, Dr. Varghese, or let's Tamash and Sangeet. And Your Excellency, thank you very much for accepting our invitation. This was a great podcast, and I'm looking forward to working together on the next project.
Thank you and
Bye.
bye-bye.
Thank you. See you.